With cold and flu season underway, antibiotic use is on the rise. As our bodies actually become increasingly immune to certain medications, there's growing concern among the medical community and really beyond about the impact of this developing resistance to antibiotics. In fact, antibiotic resistance is on track to take a higher toll on human health than even cancer. Now, since this week is Antibiotic Awareness Week, we have internationally renowned urologist and New York Times bestselling author Dr. Jennifer Berman here to help us better understand this issue. Doctor, thank you so much for being with us.
Thank you. Thank you for having me.
So I'm talking about this resistance that our bodies are having to antibiotics. How does this happen, or how serious is this? Important we should be talking about this?
Well, the seriousness of it, we're having an awareness week over it, and the UN General Assembly has put it in the same category as obesity, HIV, and Ebola in terms of the risk to human lives and the number of deaths that it can affect. The reason antibiotic resistance, or the mechanism by which it occurs, is that the bacteria mutate or transform, get smarter, if you will, over time, such that the normal antibiotics that we're using no longer work. And that means we have to use bigger gun antibiotics that result in longer hospital stays, more hospital costs, as well as more side effects. The higher, bigger gun antibiotics are more toxic and have more side effects. So those are the concerns with regard to antibiotic resistance: is cost, deaths, and getting to a point where antibiotics won't work, sort of in the days before we had penicillin, and that's kind of a nuclear DEFCON situation as far as I'm concerned that we really need to avoid.
Well, is there anything that we can do kind of naturally to avoid maybe using those antibiotics, since we're getting so resistant to this, but also obviously stay very healthy?
I mean, it sounds. It sounds. I'm talking about DEFCON 1 and global issues, and then say, well, what can I do, in my diet? But the truth is, the reality is, there are things each of us can do. You can do. I can do. Our families can do to help prevent this issue regarding antimicrobial resistance. The first is to speak to your healthcare provider. Make sure antibiotics are necessary, that you're taking them as prescribed, not longer than the duration or shorter than the duration. That you're practicing health and hygiene practices, washing your hands, getting vaccinated, and eating healthy foods that can be that are known to decrease the risk of infections. Cranberry being one of them. Cranberry has potent anti-inflammatory and antioxidant health benefits in general, and has also been shown to help prevent urinary tract infections or recurrent urinary tract infections in women. So that's one of the main infections that we deal with, is urinary tract infections. About 65% of women will experience at least one, and 34% of those will have more than one. And that's a high need for antibiotics in those women. If we can prevent urinary tract infections, that's taking a step with foods. So foods that have health benefits, nutritional approaches to our health is going to be where I believe medicine and healthcare is going. And what's really exciting is that Ocean Spray has committed over $10 million towards research in that very area. The health benefits of foods, nutrients and phytonutrients that can help combat illness, disease, and infection. That's what we're going to be seeing more about in the future.
Doctor, is there somewhere we can go online to get some more information on this?
To get more information about the health benefits of cranberry, it's cranberryhealth.com, as well as the cdc.gov.
Awesome. Thank you so much, Doctor, for joining us today.
Thank you.
We'll be right back.